It's Nick the Nurse here. Today we're going to be talking about some of the risk factors and causes for the nursing problem hyperkalemia, or elevated potassium. Now let's face it, chances are on your nursing school exam, if you have a fluid and electrolyte exam, you're going to need to know about hyperkalemia. In addition, chances are pretty high that you might get a question on your NCLEX about hyperkalemia, maybe even hypokalemia, but something to do with potassium. Why is it important that your nursing school exams and possibly even the NCLEX test you on potassium? Because too little potassium or too much potassium, in the case of hyperkalemia, can kill you. It'll kill your patient. So we want to make sure that you understand everything about hyperkalemia, and eventually we'll do a video on hypokalemia so that you can make sure to take good care of your patient if they reach the highest state of health that they can. Now anyway, back to risk factors and causes of hyperkalemia. Renal failure is a huge risk factor or cause of hyperkalemia, and one that I would encourage you as an astute nursing student to commit to memory whenever you think of hyperkalemia. Burns, certainly a big risk factor as well. Bowel obstruction, Addison's disease, acidosis, infection, excessive potassium intake. Well, duh. It kind of goes without saying. If you have an increased potassium intake, yeah, you could certainly get hyperkalemia. Dehydration, crushing injuries, I've seen that tested before on nursing school exams. And also potassium-sparing diuretic use, such as aldactone or spironolactone, can cause hyperkalemia, right? Because it's not getting rid of potassium in the urinary tract, through the urinary stream. So those are all risk factors and causes. If I were advising you which ones to pay more attention to, which ones are probably more testable, that come up more on nursing school exams, make sure that you know them all. That's my disclaimer. They're all game. But what would I, Nick the Nurse, nursing instructor and certified nurse educator, encourage you to focus on? I would encourage you to focus on renal failure. I would encourage you to focus on burns. I would encourage you to focus on excessive potassium intake. And certainly potassium-sparing diuretic use. So all of those things that we listed before are game, but those are some of the ones I would probably test you on if I was your nursing instructor. So I wish you the best of luck. My name is Nick the Nurse again, and I'd like to thank you for watching my video today. If you'd like to check out any of my other completely free videos, they're all online for free at www.nickthenurse.com, or you can subscribe to my YouTube channel, Nick the Nurse. Thanks for watching. We'll see you next time.